Part 2 of Module 6, the circulatory system. The circulatory system is also known as the cardiovascular system. It's made of the heart, blood vessels, and blood. The heart is made of layers of muscle and serves as a pump for the system. A healthy heart is important because the entire body needs blood to receive the nutrients, oxygen, and hormones it needs. The heart is composed of 4 chambers, 2 upper atria and 2 lower ventricles. The heart functions in 2 phases, systole, when the heart contracts, and diastole, the heart relaxing. This slide explains what blood does in the circulatory system. Blood circulates through blood vessels. It carries oxygen, nutrients, and hormones to cells, removes carbon dioxide and other waste products from the cells, controls pH level and body temperature, and also can function to make clots in the blood and deliver white blood cells that fight pathogens and poison. There are 3 types of blood vessels. Veins carry blood back to the heart, arteries carry blood away from the heart, and capillaries, which are very small and they bridge between arteries and veins. When veins carry blood to the heart, they bring the blood to the lungs to collect oxygen and remove carbon dioxide. This is called gas exchange. The heart then pumps the blood that has oxygen through arteries to deliver the oxygenated blood to tissues in the body. Capillaries are tiny blood vessels that disperse into tissues of the body that continue delivering the nutrients, oxygen, and hormones that are needed. The capillaries can remove cells, tissue, fluid, and waste as well. The circulatory system, including veins, arteries, and capillaries, is connected to the entire body, including the kidneys, and kidneys are vital organs because they further remove waste from the body. Normal age-related changes in the circulatory system include the following. The heart pumps less efficiently, blood vessels narrow and become less efficient, blood vessels become less elastic, and blood flow decreases. Complications and common disorders include hypertension, HTN for an abbreviation, which is known as high blood pressure. Current practice has determined that pressure greater than 130/80 is considered stage 1 hypertension. It's important to follow the most current research as a CNA. Health research is constantly growing. As you study, be aware that your book may be slightly outdated. This is the most up-to-date information from the American Heart Association. The state of Iowa acknowledges this information. If you have any questions, please ask your instructor at lab. Coronary artery disease, abbreviated CAD, another complication, is damaged arteries that supply the heart muscles themselves. This happens when plaque forms in the artery and narrows the passageway for blood. When the blood supply to the heart is reduced, the heart can't get oxygen. This can cause an MI, which is known as a heart attack in layman's terms. MI stands for myocardial infarction. A heart attack occurs when all or part of the blood flow to the heart is blocked. If this happens, the person has several key symptoms called cardinal symptoms. The main symptom is known as angina pectoris, or angina for short. This is the medical term for chest pain. Peripheral vascular disease is another complication of the circulatory system. It is a condition in which the blood supply to the legs, feet, arms, or hands is decreased due to poor circulation. This is also due to plaque buildup in the arteries, or it may be caused by phlebitis, which is inflammation in the veins. Decreased blood flow from PVD can cause cool skin in the affected areas, pain or cramps in the legs, and discoloration, bluish color in the hands or feet. Congestive heart failure, CHF, is a condition where the heart cannot pump effectively. Usually one or both sides of the heart has been damaged from MIs, CAD, valve problems, or HTN. Blood in the heart backs up into the legs, feet, or abdomen, creating general congestion of fluid in the body. Activities of daily living become more challenging because the heart is not able to meet the body's regular needs. Some of the signs and symptoms include fatigue, difficulty breathing or dyspnea, reduced ability to be active or tolerate exercise, weight gain, chest pain, dizziness, and edema. We modify the activities of daily living by taking our time while working with those residents. Report these observations to the nurse: headaches, blurred vision, dizziness, confusion, fatigue, reduced activity, irregular or increased pulse, chest pain, angina pectoris, I just mentioned, dyspnea or orthopnea, blue discoloration, cyanosis. Orthopnea is when someone experiences shortness of breath when laying down. It is improved when they are sitting up. Also report cramping in hips, thighs, legs, or calves, extremities that are cool to touch, sores on the legs or feet, edema, distension, or weight gain. Edema is different than physical weight gain, but it will show up as weight gain on a scale. Edema is fluid that has moved out of the bloodstream into tissue and has not returned at the rate it should. It wasn't reabsorbed. Those tissues are not meant to hold that much fluid. CNAs assist the nurses with caring for residents with edema. Elastic stockings can help reduce edema in the feet and legs, as well as help prevent blood clots in those areas. Dependent edema is shown in this first picture. Dependent edema is more common during the day when the feet are below the level of the heart. This can be improved by elevating the legs to the level of the heart. The extremities are dependent. That's what we call that. Using a footrest or recliner with the legs up is an easy intervention during the day. Pitting edema in the center means the nurse has determined that the body of the resident is retaining fluid in that area versus gaining physical weight. The indent or pit on the skin shows that it's pitting, and therefore it is edema, and it's not fat or muscle. Medication assists the kidneys to move fluid back into the bloodstream and out of the body. Edema can happen in the hands as well. It is important to position residents with circulation issues with their arms and legs elevated. Use pillows or positioning devices as much as possible between activities. Bring the hands to the level of the heart and prop them comfortably on a pillow. Bilateral edema means both sides. Interventions include following instructions by the nurse as appropriately delegated to the CNA. A nurse may request that you obtain vital signs. You will be taught how to do this in lab. Vital signs measure important information, hence the name vital. Assist residents to remain calm during stress, allow rest, and remove stressors, reasons, things, or people that cause it to worsen. Encourage comforting measures, maybe a movie, a quiet environment, or even a back rub to help relax the heart and reduce anxiety. Avoiding large meals, hot or humid temperatures, and too much physical activity at one time helps prevent further complications of the heart. The body needs room for the heart to contract. Large meals leave less room for the heart and the lungs. Temperature changes make more work for the lungs, which are directly next to the heart and where the heart receives the oxygen it needs. Physical activity makes more work for the heart and lungs. Nurses only can administer medication for chest pain. The most effective medication available is usually nitroglycerin. If you are with a resident that is getting nitroglycerin, you may be asked to stay with them to monitor them while the nurse is doing other tasks. Nitroglycerin is usually given for acute angina. However, some doctors order it daily for people with high risks. Assisting with ADLs is essential for the CNA to perform. The resident will not always realize they need help or ask for it. That will depend on the resident. CNAs are to follow the care plan, and if there are any questions or concerns, to talk to the charge nurse right away. More interventions are seen here. Measure daily weight and I&O according to the care plan. Encourage residents to follow fluid orders. Use special stockings as ordered. Extra pillows in bed may help reduce orthopnea. Further promotion of cardiac rehabilitation. When someone has had a heart attack, they often have some prescribed therapy, and that is something we need to also encourage and promote in long-term care. Cardiac rehab instructions may include low cholesterol, low fat, or low sodium diets, regular exercise programs, medication to regulate heart rate and blood pressure, stopping smoking, stress management programs, and avoidance of cold temperatures. Foods with unhealthy fats and cholesterol contribute to plaque in the blood. A low sodium or low salt diet helps to minimize fluid retention because fluid is attracted to sodium. Moderate physical activity helps keep the heart strong. The therapist will provide instructions, and the nurse aide may be taught how to perform specific exercises for residents that have cardiac rehab in the facility. This concludes the circulatory system chapters. Please use your book for more reading and review of this information.